I'm here to talk about all things well, what's happening in light of the pandemic. Um, as Stanley mentioned, my professional training was in the field of ergonomics. And one of the things that really drew me to the well building standard and this healthy buildings movement is how holistic and preventative in nature this building certification program can address not only physical health and well-being, but mental health and emotional health. And truly, in a moment like this, 1 year after the start of the pandemic in New York City and across the United States, a year plus however many months after this started abroad, this has really never been a more timely or more relevant conversation. So COVID's taught us a lot of things. It's taught us that people are now really perceiving this link between our physical environment and our health. It's exposing things in the health equity lens, how those populations who are typically underserved are also being affected most by the pandemic. And it's also drawing that link through not just being reactive or trying to talk about preventative health intentions, but also looking at how our environment can shape and factor into our lifestyle through chronic and infectious diseases. Well has been in the marketplace forever. For the last, 10-ish years. And our mission truly is to advance the health of all people in all places, all over the world. We have evolved and always provided evidence-based recommendations that look at understanding performance through multiple lenses, right? We're looking at the performance of our buildings, doing evaluations about how clean the air is, how clean the water is, how a high functioning or high performing building is working. We're also looking at the return on investment. Once we've updated buildings and facilities and infrastructure, what is that doing to a business's bottom line? How is that impacting productivity and retention and engagement and all of these aspects at a human level? And we're pulling from various different buckets that's influencing the evolution of the well building standard and the research that our program has been shaped from. That research is either coming from the field, from actual well projects that are doing pre and post occupancy evaluations. It's coming from leading academic institutions and leading other standard setting organizations and our advisories. And it's coming through collaborations with actual lab-based research where we're saying we know the thresholds that we've established for how clean air needs to be. Now let's run some experiments and see directly how that links to human health outcomes, cognitive performance, mental well-being, our ability to sleep at night. And so we are truly a research-based or evidence-based program. Some of the other categories in which we are differentiated in the market is how we're taking that research and we're actually translating that into practice. So some of my colleagues have mentioned this phrase, well as an encyclopedia of evidence-based strategies that are essentially performance verified through third parties on site, right? It's tons and tons, countless ideas about how to improve the health of occupants, building occupants, human beings in any space types all over the world. We partner with our projects to provide technical support and coaching and guidance to continually improve and continually iterate on this research and understand how to make high performing environments in all different sectors around the world. I mentioned that we've been in the market forever. It's truly not forever. We originally launched the first well building standard in 2014, and that had a primary focus on commercial real estate. Over the years, we've introduced a series of pilots that have applied to various different space types. And we've also started to expand the way that we think about this certification program and that we think about the pursuit of well-being. So no longer are we really in the business of kind of certifying buildings one at a time. But since 2019, we've introduced this portfolio opportunity where organizations can use the features within WELL and start to track individual building performance over time and start to make more holistic decisions at a portfolio scale that looks at the types of strategies within WELL and is just constantly kind of iterating or moving the needle forward. Last year was a big year for us for many reasons. I'll get into it. But it was the year that marked the graduation of WELL V2 from its pilot form to its fully baked standard, and also the year that we introduced the new WELL Health Safety Rating, which I'll detail a little bit later in the talk. Before I get too into the weeds, I want to take a step back and just talk about the types of strategies and recommendations that you'd see within the WELL ecosystem. So WELL is kind of equal parts that which the building can do and that which the human can do to support human health and well-being. We've got strategies that relate to the way that a building is designed or constructed, as well as those that relate to on-site operations. Right? Where are the stairs located? Are they trying to activate more physical activity and more movement throughout the space? From an operations or facilities management perspective, what types of policies have you standardized on? Are you doing healthy cleaning? Are you encouraging best practices when it comes to the products that you're selecting from material health and safety? And then looking at that policy piece, that's the third piece of this three-legged stool. What is an organization doing to promote health in all forms, mental health, physical health, social cohesion among groups? And the way that our offerings kind of speak to one another and stack up against one another is kind of detailed in this diagram on the screen here. So the WELL building standard is the original, right? We've been in that market since 2014. The health safety rating is really limited in scope. It's a subset of features, 22 in total, which are the most timely and relevant in response to this health pandemic that we're in right now. It's essentially showing our clients all over the world, if you're going to take a step towards using a third party to verify health and safety within your physical environment, these are the recommended strategies that you should start with before you think about expanding into a more holistic health solution through the WELL certification or a more holistic real estate solution through that portfolio program. So we're finding today, especially for the past year, we've seen huge growth and uptick in the certification numbers and in the portfolio registration square feet. Anywhere from 1 to 2 million square feet per day have registered since last March. And within the health safety rating that was introduced back at the end of June 2020, we've seen about 100 million square feet per month decide this is where we want to begin our health and wellness journey. This is the place to kind of start. Now, to give everyone on the line the full context, the WELL building standard for the pursuit of certification or for involvement within that portfolio program is based on a 10 concept framework. These concepts are looking at things like how clean the air needs to be for human health and mental support. We reference studies like the COG-FX study that came out of Harvard that looks at how when CO2 levels rise in an environment, our cognitive performance tends to decline. So we're establishing thresholds there. That's performance verified on site. It's pretty straightforward, easy to understand. The water quality or the water concept is another category where we're establishing that quality benchmark. This is how clean water needs to be for human consumption. Same with lighting levels. We know the way that the human body evolved was to be more attuned to a natural day cycle, right? Our circadian rhythm means we need to be exposed to bright light during the day, be able to sleep in the evening. That's going to create the best environment for work outputs. That's another one, performance verified on site. Same with thermal comfort, same with acoustics. The other concept areas are using things like nudge architecture or policies that govern human behavior to encourage more physical activity, to ensure that you're selecting the healthiest of all materials, to ensure that you're establishing a strong connection to nature or a connection to culture or that environment. You're offering healthier foods, essentially just that you're making it easier for the people within your buildings to make healthy choices. That healthy choice should be that default choice. So I'm not going to spend too much time going into the details of these features. They're all available on wellcertified.com, and the standard is free for anybody to access. You can see the citations. We actually just published these really robust research digests that translate all of the evidence behind each and every single one of the features within Well, and puts it into layman's terms, super easy to understand why air quality is important if people weren't already thinking about that after an entire year in a pandemic, or why it's important to have a healthy nourishment program, or so on and so forth. So those are all accessible, available. All of this information is on the website. I would encourage you to kind of check it out and dive in. I want to talk a little bit about what's motivating our clients and kind of how we found ourselves within this hockey stick growth moment. We are presently working with probably 20% of the Fortune 500 organizations around the world. We're seeing massive adoption and uptick. So the square footage represented on this slide represents those pursuing certification or involved in the portfolio program, and does not include the other 800 million square feet of projects that started with the health safety rating. We also really appreciate being a third-party organization where our work is verified by third parties, to have access to case studies and reports from the motivators of clients all over the world as to why they pursued certification in the first place. So the World Green Building Council puts out a report every couple of years that looks at the impacts of healthier environments, high-performing environments, LEED certified environments, as well as WELL certified environments, and it reports out on all things like improvements in productivity, reduction in turnover, reduction in sick days. ULI does the same thing. They expand their scope and look at not only commercial office spaces, but they also look at residential spaces. And they talk very transparently about how quickly organizations can recoup the investment in investing for health and investing for people, and prioritizing people as the bottom line to an organization's success. So I've linked those resources here and can certainly send this material as follow-up. I wanted to tell you all a bit about some of the work that we're doing in the government sector and for the public benefit sector. So last year, we announced a partnership with Enterprise Community Partners, whereas all of the homes that certify to the Enterprise Green Communities will also receive a dual certification with WELL. This was an effort to really ensure that low-income housing is just as accessible and just as able to create healthier environments for their occupants as the commercial real estate sector or as multifamily residential. We have various sector leads that are working in airports and senior living facilities. I'm working in the government education and healthcare facilities. We've got people who specialize in each of these areas. And as I'm having conversations with governments, it's really interesting to see some of the uptick in adoption. So places like the city of Austin or the city, oh, I totally just lost it. Oh, the city of Adelaide in Australia are going out on the map to become the healthiest city, to enroll as members of IWBI and start putting their federal buildings through the certification program or through the portfolio program. We're also seeing really great uptick and support. So the National League of Cities and the US Conference of Mayors have both endorsed things like the health safety rating as a clear step to creating healthier environments within their communities, and other cities throughout the US that are starting with enrolling their town, their city hall buildings, their municipal like libraries, whatever kind of subset, to really start to give back and bridge this confidence gap about re-entering spaces that serve the entire community. When COVID initially hit, we decided as an organization to take a pause and to stand up a task force on COVID-19 and other respiratory infections. And part of the goals of this task force were to come up with new guidelines for prevention and preparedness, resilience, and recovery, and then also to evaluate the standard as it was written and see if we had any gaps or blind spots in light of this new pandemic. And what came out of this task force was a number of things. We created guidelines, which will be published very soon, that go into sector-specific detail about how to bounce back, what to prioritize, the strategies within WELL that are actually the most relevant, that was shaped by many of these incredible participants in the task force. We had nearly 600 leaders, virologists, building scientists, architects, academics, everyone who kind of came together and talked about everything that we know about the evolving pandemic, everything that we know about how buildings are, their sole purpose is to keep us safe, and how we can elevate the role of buildings and of facilities management professionals to keep people safe during this pandemic. So one of the other outcomes, aside from the guidelines document, was an initial document that just pulled out all of those key strategies in WELL that already existed, that might have needed a few tweaks here and there, but that essentially helps to protect people and keep us safe from this pandemic. So those types of strategies are organized around these 8 key themes. They're things like keeping environments and surfaces and products and finishes clean within the built environment, improving things like air quality. We know that this is an airborne pandemic, so having an understanding of a building's ventilation rate and performance really helps to instill that confidence that these environments are safer. Looking at things like water quality. So when buildings sit unoccupied for large periods of time, they have the potential to become breeding ground for Legionella. So not walking back into a new problem that might not have otherwise exist if the buildings didn't sit unoccupied for the better part of the past year. And then looking through a number of other strategies within WELL, like supporting mental health of our employees, enabling people to work remotely effectively where possible, improving people's immune systems in general, whether that's through promoting vaccines or creating smoke-free environments or keeping people more physically active. All of these strategies are kind of pre-tagged for those projects that want to get started and want to create a healthier environment and want to have information about the best way to get started. The second thing that came out of that task force was the WELL Health Safety Rating. And you might have seen commercials for this on television at this point in time, but the WELL Health Safety Rating, as I mentioned, was truly this subset. It was this rating to meet this moment that we're in. It's being pursued and achieved by incredible organizations all over the world. The Empire State Realty Trust put their portfolio through it. For those in New York, other places you can look for it are like Yankee Stadium, I've been out of New York City for a long time, so I stopped tracking all of the buildings here that were getting it. But we've got several large organizations adopting and achieving this rating as it stands now. These were some of the earliest brands to get on board. As I mentioned previously, there's about 100 million square feet per month. So this represents a snapshot in time, but we're seeing lots of growth in the financial sector, lots of growth in the insurance sector, lots of growth in the tech sector, lots of growth through schools, through developers, through governments. It's been truly incredible. So I will spend a little bit of time just kind of talking through these strategies. These are strategies and recommendations that were put forward by the CDC and the WHO and ASHRAE's Epidemic Task Force. And the true value in this rating is to have that third party that verified all of the interventions that you've implemented post-COVID have been effective, have been based in evidence, and have been third-party verified. So this is truly a program where you can communicate effectively to regular building occupants, to people passing by, all of those measures that you've taken to keep people in that space healthier and more confident to return to these spaces. So it looks at cleaning and sanitization. It looks at things in the emergency preparedness categories. It looks at promoting things like sick leave so that people aren't showing up in environments where when they really shouldn't be, how you're supporting mental health. This has been a challenging year for everyone, to say the least. How you're looking at the air and the water quality management, and then essentially how you're communicating effectively to your stakeholders these types of interventions that have been met. So the rating is based on 22 features. In order to achieve this rating, an organization needs to demonstrate compliance with 15 of the 22 features. That is then the documentation for this effort is then third-party reviewed by GBCI. They're the same third party that reviews for the WELL certification as well as for LEED certification. So many organizations are somewhat familiar with them. And it's the timelines on these reviews is about 1 month. It takes GBCI about 1 month to review the documentation submission, potentially make any corrections, another month for review, and then moving forward. So some of our largest organizations like JP Morgan Chase, for example, was able to enroll 6,200 locations within this program and achieve the health safety rating and start putting up those seals in as little as 3 to 4 months. The features, again, fully available to dig into online. I'm showing a snapshot of what it looks like when you navigate to the features from our main website. And all of the research behind them as to why these strategies are important are also available online. So I know that this is kind of a crash course, brief overview. I want to give you time for questions, but one of the things that I'm truly excited about is that this is the first time we've really gone direct to consumer with talking about the importance of healthy buildings. I think everybody, regardless of what your situation was over the past year, now knows truly how important our environments are. I relocated from New York City to my parents' house for a while, to various Airbnbs for a while. I'm now on my way to get set up in the Denver, Colorado area. And as a professional ergonomist, I've always known how important my workspace is and how important my access to light is. And this is essentially what I've been trained in for my entire career. But I think those who miss their office are starting to realize why, and those that don't are also starting to realize why. And you know that by having the confidence of a label to know that the space has been thought about is really building that confidence at the consumer level. So I mentioned you might have seen this before. If you watch TV, keep an eye out on any of these channels and many, many more for the national commercial that's talking about this health safety rating. If you have questions about that program or anything else that we're doing at IWBI, I've got my contact information on the screen here, but I'm going to pause there and open up for questions because I know we've probably only got 15 minutes left or so.
Well, just first remarks, thank you so much for that, Angela. I mean, there was a lot of information, and I know that there's a lot more that's available through your organization. But I really wanted to introduce you to this group, and there will be a much larger group that will also be able to take advantage of this information. So thank you for that, and I gave that quick pause, so those of you that have questions, here's your opportunity.
Hi, I have a couple questions. Angela, thank you so much. This was really fascinating, and great to see how your organization is pulling together all these recommendations from other places right now as well, and putting that into something where you can get the certification. So I was curious because I'm not sure that I understood you correctly when you were saying, so to get the health safety rating that you were talking about, the recommendations that you organized, I think it was 8 categories, maybe 6. These are recommendations out of both the well building standard and from ASHRAE and the CDC, or they're only from those latter organizations? This year.
Yeah, so these are kind of feature names for the entire health safety rating on this over here. So as we were developing the health safety rating, we were pulling in information from the World Health Organization, the CDC, ASHRAE's task force, our own advisories, and our own task force of all of these professionals, and the many, many years that shaped the development of the well building standard.
Right.
So in well, there's like hundreds of strategies.
Yes.
So sometimes project teams don't necessarily know where to begin. So these health safety features, this is just 22 features. In order to achieve the rating, you pick any 15 that you're already doing. It's a documentation review, right? So as you're going in and detailing what it is that we're asking for supporting hand washing, it's, do you have the right type of hand soap? Do you have the right types of hand dryers? Do you have signage about how to wash your hands? If you're doing all of those things and you're documenting compliance there, then you can consider that one point closer on this journey towards finding 15 of those features within these categories. And then from there, you can decide we're 15 points closer to a well certification, or we're 15 points along the way towards this well portfolio journey. So it gives organizations the opportunity to kind of scale between one program and the next.
Okay. To think of it as the first step. Got it. Okay, thank you. Very helpful.
Absolutely.
The question that I have, Angela, is do you then have partner organizations in the various cities and regions of the world that actually will verify, or is this all done by IWBI? You've made some mention of third-party verification, so can you just clarify that and what that means to somebody that wants to come into the portfolio?
Absolutely. So for this health safety rating, the third-party verification is working with GBCI. They review all documentation for all projects all over the world that are enrolled in this program right now. For organizations that are pursuing well certification, there's a performance testing component to half of the concept areas in well: air quality, water quality, light levels, acoustics, and temperature of the space, that requires a third party to come on site and actually do testing and ensure that you're meeting those thresholds. that can be done by GBCI or any of our other performance testing organizations. So it's not exclusively GBCI, it can be anyone that's been trained by them, that might be a local partner, that might be somebody that you're already contracting with for building commissioning. So that's certainly more broad, but that's for the pursuit of certification or trying to achieve those points within that well portfolio opportunity. But in the health safety rating, since it's just a documentation review, when you enroll in this program, you get access to sample documents for every single one of the features, and you can work with consultants or you can do it in-house to document your compliance there, and then you submit that collection of documents to GBCI, who's the third party for this program.
Thank you.
Mm-hmm.
Other comments or questions?
I have one, since no one does. What have you seen has been probably the most dramatic shift in the way that you're interacting with your customers in the buildings industry, kind of in this COVID era? I mean, I heard what you said about how the demand for well certification and just understanding more about healthy buildings has understandably increased, probably, you know, upwards of tenfold. But how has that kind of been at the tactical level in terms of the actual questions people are asking and the ways that people are, you know, engaging with IBWI?
Yeah, that's a really great question. I think the timing of when we developed portfolio level offerings couldn't have been any better. The fact that we can engage with organizations and think more holistically through their entire real estate strategy and their entire decisions, like thinking back to the 3 different types of features, the only ones that are usually unique to the building are those that have to do with design. But from an organizational perspective, typically policies remain consistent and operations remain consistent across their entire portfolio. They've contracted with a vendor, this is what they're doing. They have to give everybody in every building the same HR benefits. You know, you can't treat people in some locations better than in others. So having that shift in conversation about, you know, we're no longer interested in just certifying our new build or just certifying our headquarters or just certifying the project that's going under a renovation, but we're actually interested in figuring out how can we establish a culture of health at an organizational scale where we're prioritizing everyone equally and we're trying to streamline the pursuit of either achieving certifications through the portfolio program or not. Maybe it's achieving the health safety rating across the entire portfolio and then systematically working their way through features within well that are relevant based on the population that they're serving or based on various other factors. We've done a number of mappings to various programs. So like we've mapped to the UN Sustainable Development Goals. So we can help organizations that are committed to meeting any of those goals pick the features that will have the most impact. We've also mapped to programs like GRESB. So those that are doing ESG reporting or CSR reporting and want to get higher scores in GRESB, we can show them the features that will give them impact and leverage there. It's really like our conversation has just completely shifted. It's no more like one building at a time. It's truly like, how do we bring everyone along this health journey together? And everybody understands now the importance of things like performance testing, right? Before there was this whole narrative around, you can't truly tell me that you care about air quality if you haven't measured it once. Right? Like these are things that are typically imperceptible to us, right? You don't know that there's a problem until you've tested for something and solutioned for it. But now not only because of COVID, but due to things like the fires that take over the West Coast and the central parts of the United States. People know that air quality is important, and they have access to testing air quality, and they know that they're not going to go inside. Like, even on your iPhone, it'll tell you if the air quality outside is unhealthy. And so just having that data and that information more top of mind for general people in the world who might not have ever thought about their environment before is really pushing organizations to think about, how are we going to get people to come back to the office and feel healthy and feel safe and feel good about commuting again, and giving up working remotely or whatever it may be, and why, and should we, and how do we tackle kind of these competing priorities, and just make sure that whatever environment we're providing for them, we've done everything we can within this space to make it the healthiest, safest, best possible environment that it could be.
Thank you.
Well, terrific. Well, we again want to say thank you, Angela. I'm sure that there would be other questions. I think that if any of you have questions that you want to write down, or otherwise, we can make available to you Angela's email, and I'm sure that she would be more than happy to be able to address your questions offline as well. So again, thank you so much, Angela, for taking the time to join us today. Very insightful. I feel that there is a lot of alignment between what we are trying to do in facilities and healthcare, with well buildings, and with what past studies that we just did with the life cycle analysis that was just recently presented on, are very much in alignment with what you are doing at IWBI. So we're very happy that you are here, and thank you again.
Thank you so much for inviting me. So nice to meet you all.